welcome to the new season of the Central Bucks Senior Taskforce. We are meeting here at the Central Bucks Senior Center. We do this on the first Monday of every month, except for the hiatus that we take during the season, during the summer, June, July, and August. My name is Jim McGowan, and I will be hosting today's broadcast. The issue for today that we're going to talk about is Medicare. A lot of people out there, there's a lot of people turning 65 every day now, okay, upwards of 10,000 I understand in the country, and I think we all need to understand more about it. I started studying about Medicare about 3 years before I turned 65 in the hopes of trying to be able to figure it out. Our guest today is Janine Slabicki. She is the Apprise coordinator for the Area Agency on Aging. Apprise may not mean much to you folks right now, but by the end of this interview, I'm sure you're going to understand a lot more about it. So without any further information on my part, let's turn it over to Janine and find out what the Apprise program is.
Okay.
Welcome, Janine.
Thank you, Jim. The Apprise program is a free, unbiased Medicare counseling service. We also are an educational service. We turn no one away. Anyone who has a question about Medicare, whether they have a relative who is on Medicare, if they are disabled for over 24 months and Medicare eligible, we assist those people with Medicare. Obviously, people turning age 65 is the typical age when people become eligible for Medicare. And we also assist people who have been on Medicare for years and may have questions or issues with their Medicare program or a bill, they need help going through an appeals process. We assist through all aspects of the Medicare process.
Okay. Why is there a need for a program like this?
Well, Medicare sounds very simple. It's A, B, C, and D. And as someone who has been through the process, Jim, you know that it is not as simple as A, B, C, and D. Part A is your hospital coverage, and you become eligible for Medicare either in your 25th month of disability, which could be at any time after age 18 when you reach your 25th month, or typically when someone turns 65, they become eligible for Medicare. Medicare A is free if you have worked for 10 years or more in your lifetime and you are an American citizen for 5 years or longer. Part B of Medicare is your doctor coverage. So original Medicare is composed of Medicare A and B. A and B cover only 80% of your Medicare costs. So you need some type of supplemental plan to cover the extra 20%, plus a prescription drug plan, which is usually Plan D. So you have A and B, which is 80% coverage. You need a supplement plus a drug plan.
Okay. How are your services provided? You coordinate the program, but what does that mean to the people out there in the world? How does the information get given out?
Well, I'm the Apprise coordinator, and I'm the only paid person with the program. We have approximately 15 active counselors that meet with people throughout the year at sites throughout the county. And what they do is they call our number at the Area Agency on Aging, which is 267-880-5700, and they can make an appointment at any location throughout the county. It's a one-on-one appointment with a seasoned Medicare counselor. The counselors go through quite an extensive training to become a counselor. It's not something where they say, I want to teach people about Medicare, they view a webinar and that's it. It's quite an extensive process. It takes about 6 months for someone to start with their webinars, go through in-person training, go through mentoring process, and start counseling on their own. So in Bucks County, we have recently run a very successful ad campaign where we have approximately 15 new counselors who have just gone through the training, and we're gearing up for what is known as the silver tsunami, this wave of people who are about to turn 65. and we're getting ourselves prepared to serve those people to help them navigate through the Medicare system.
I see. Would you think that the Medicare program is more or less complicated than our tax system in this country?
I would say it's probably more complicated.
Okay.
Because I want to go a little bit into how you cover that extra 20% that Medicare A and B
Okay.
does not cover. One way is a Medigap plan, and a Medigap plan covers the extra 20% that Medicare A and B do not cover. It does not have a letter. It's called either a Medicare supplemental program or a Medigap plan, and it's taken anywhere throughout the country. You do not need referrals, you do not pay co-pays, and the monthly premium is typically higher than the other supplemental program that I'm going to mention. But like I said, if you're a snowbird and you go to Florida for the winter or you travel a lot, you don't have to worry about where your Medicare will be accepted. It's accepted any place that accepts Medicare. In addition to that, you need a separate prescription drug program. And how you find that program is, there are two ways. You can meet with one of our Medicare counselors, or if you are computer savvy, you can go on a site called medicare.gov, G-O-V as in government, enter your prescription medications, and all the plans will pop up going from the least expensive to the more expensive programs that will cover your medications. The second way to cover the extra 20% that is not covered by Medicare A and B is called a Medicare Advantage plan, and that is also type C, Medicare C, which gets very, very confusing. So
There go the need for the counselors.
Right, yes. I very rarely call it the Plan C because people just get confused. It's an HMO or a PPO plan, which is also called a Medicare Advantage plan. It typically includes your drug plan. With that program, you need to make sure your doctors, your hospitals are included in the program. It's usually very localized. You need to get referrals to specialists for any type of treatment that you're going to get. And there are also co-pays involved with each visit. And like I said, your drug plan is included in that for 99% of the programs out there.
Okay.
So as you can see, A, B, C, and D kind of go out the window when you're talking about Medicare. It's very confusing. So that's why we have the counselors to help people navigate through this system, give them good information so that they can make the right choice for the plan that is best for them.
So it sounds like people should come prepared with notebooks and pencils to take all their notes when they meet with the counselor.
Exactly. The most important thing for them to bring is the list of their medications, not only the names of their medications, but whether they take a brand name or a generic, their dosage, and how often they take it, because that will make a difference in the pricing of their medications.
Mm-hmm. Now, are the counselors available throughout the year, or I understand that coming up in October is what they call the open enrollment?
Right.
Okay.
The counselors are available throughout the year, throughout the county for one-on-one, 1-hour appointments every week of the year. We have them scattered throughout the county, and as the 15 new counselors come on board, we will have even more counselors in some of our more needy areas of the county. Right now, we only have one counselor in Upper Bucks, so the people in Upper Bucks need to come to Doylestown. We're looking to get more counselors up in that area. And like I said, the program runs year-round, whether it be a question or an appointment. Any day of the year, you can make a phone call. Obviously, we're not there on weekends and county holidays.
Mm-hmm.
But you can leave a message and we will always get back to you. Appointments, as I said, are made through the Bucks County Area Agency on Aging, and they're made to be convenient to your location in the county. You had mentioned the annual open enrollment period, and that's coming up. It's from October 15th through December 7th. And that is the one time of year where you can change either your Medicare Advantage plan, which is your HMO type plan, or your prescription drug plan for the following year. So October 15th through December 7th, you make your change if you want to. If you do nothing, your insurance will stay the same for the following year. But by the end of September, your current company will have to send you what's called an annual notice of change, and that will tell you about any changes in your current plan. So if one of your medications is going to be removed from their plan, or one of your doctors would be removed, if the price is going up, if the co-pays are going up, you can search out other plans that would fit your needs better. And like I said, and I'm going to probably repeat it several more times, October 15th through December 7th, you make the change, which will take effect January 1st of 2017.
Understood. When I applied for, when I was coming of age, shall I say, to be able to receive Medicare, I would get all these, an influx of mail came in, okay? Go here for pizza and soda and find out about our program. Go here, you know, there were so many vendors out there that wanted your business, and they did it in a group setting. Does the Apprise program do things like that in a group setting, or is it just one-on-one?
Well, let me address your mailbox question first.
Okay.
At this time of year, your mailbox, if you're on Medicare or someone who is going to be turning 65, they're the two times when your mailbox will be filled with information from all different insurance companies saying, we're the best program, come with us, we offer the best rates, and you really need to do your research. The number one thing you have to do is any information you receive from your current insurance company, you need to read that, because that's what you're really interested in, to find out if there will be any changes, and if there are changes, what those changes will be. The second thing is, during this time of year, there are unfortunately a lot of scams out there, where people will send you information saying, oh, if you call this number, and they're typically trying to get your birth date and your social security number, we will give you a free item. Or there have been instances where it says a family member has purchased this for you. Just give us your social security number and we'll send it out to you. Do not ever give out your social security number to anyone unless you made that call and you know who you're talking to. So this is a big time. There's a senior Medicare patrol and the Pennsylvania Attorney General's office, where I often refer people to report suspected scams. And the thing I tell people is to go with your gut. If it sounds too good to be true, it probably is too good to be true.
Gotcha.
And to never give that social security number out to anyone unless you know who you're talking to and you initiated the call. Fortunately, by the year 2019, Medicare will not be your social security number. It will be a different number. But for now, the social security number is your Medicare number.
Okay, that's good to know. I didn't realize that was coming. How soon would you suggest that a Medicare a potential recipient start researching this? Is this something you think someone can understand in a month or two of going to a meeting here or there?
No.
Or
Well, you were smart. You started 3 years out.
I did.
So, it may not take necessarily 3 years, but I would say about a year out to just get
Okay.
some basic information, start learning about A, B, C, and D, what your options are. You know, if you travel a lot, if you might want to go with the Medigap as opposed to a Medicare Advantage plan. For people who are new to Medicare, they have the 3 months prior to their 65th birthday, the month of, and the 3 months after their 65th birthday to sign up for a plan, which if they sign up before, it would be effective the first day of their birthday month.
Gotcha. Okay. Does someone there's a lot of people that are working past 65 now,
Right.
Okay? It used to be 65, you look forward to that date and you're done, you got your gold watch, well, now that was my father's generation. Yeah, people look forward to, starting to live their retirement years. Does someone who is 65, do they have to sign up for Medicare? If they
No.
work for a corporate concern and they have all these healthcare benefits coming at them?
Right, well, these days, a lot of people are working past age 65. So for those who choose to work past age 65, what we typically recommend is they take Medicare Part A because that's free, and that will cover 80% of their hospital cost. Keep what is considered creditable coverage, which would be their insurance through their work, and they can defer Plan B, which is the doctor coverage, and their prescription drug program. And then they will get an open enrollment period once they do retire.
Okay, I understand there are some penalties involved if you don't sign up for some of these
Right.
different programs.
If you go without insurance, you do not have creditable coverage, and you do not sign up for Medicare Part B or Part D, as in dog, there are penalties. I had a 91-year-old gentleman who was never on a medication, and he called me at age 91 and said, I just found out I have this huge penalty, while all this time he thought he was saving the government by not signing up for Part D. And unfortunately, it's not something that I agree with, but it is a reality.
Yeah.
There are penalties if you do not have insurance and do not sign up for Parts B or D.
Good reason to talk to one of the counselors there,
Right.
because of that. For someone, I was self-employed for most of my adult career, and I had to pay my own health insurance, okay? And it was quite expensive.
Right.
I was fortunate in that by the time the affordable health care came into play, for me and my situation, it went down, okay, my monthly cost, okay? And then, like, after a year, I then became eligible for Medicare, so I was able to get what I consider something that's affordable for me. But even so, I'm sure there's some people that you do have to pay for, some of this stuff. What about for people that don't have the money, that have never really had medical insurance in their life? How does the government work with
Okay,
that?
let me address first the Affordable Care Act. Once you become eligible for Medicare, you are no longer eligible for the Affordable Care Act.
Okay.
So some people say, oh, I have this great program through the Affordable Care Act, I don't want to give it up, it's cheap, it meets my needs, but it is illegal to have the Affordable Care Act and Medicare at the same time. And once you're eligible for Medicare, you are no longer eligible for the Affordable Care Act. There are many income eligibility programs out there for people who are of low income. There's medical assistance, which medical assistance and Medicare together cover 100% of a person's medical needs if they go to doctors who accept both insurances.
Okay.
There are also programs that would help pay for Part B has a premium. That's why when people who are still working, they just take Part A because that's free.
Okay.
Part B has a premium of $121.80 per month. So if people have low income and low assets, the government will pay that $121.80 for them. There are also prescription drug programs out there. One is called Extra Help. It used to be known as the Low Income Subsidy, where it offers very low costs for prescription medications.
Okay, and then there's also, I believe, PACE and PACE-Net.
PACE and PACE-Net, that's
That-
for a little higher income level. And PACE and PACE-Net do not count your assets. So if you meet the income criteria, it's an excellent program to help people pay for their medications. And it's funded through the lottery.
Okay, great. What type of restrictions are there if you get Medicare? Like, with the program that I had before Medicare, I could, be in California and use the services there. I could be anywhere, okay?
Right.
With Medicare, are there some restrictions for, let's say, if you're going on a vacation overseas? Should you prepare for that, or
Right.
how does
Well,
that work?
There is the Medicare Advantage, which is the HMO type plan that we talked about, that is very localized. You have to use doctors, hospitals, specialists within the network. And like I said, it's geographically localized. With the Medigap plan, there are many different Medigap plans. So even, there's not just one Medigap where you can say, oh, this covers the extra 20%, I'll take that. There are some that cover the Part B premium, some that cover overseas, some that cover, that they all are accepted at any place that takes Medicare within the United States. But there are many different Medigap plans as well that you really need to see a counselor and do your research on that as well.
Okay, so it's not carte blanche. When you have Medicare, you can be anywhere and
Right.
you're covered. You have to
Right,
know
so
what
it's-
your plan,
You
okay?
need to know what your plan covers, and you need to make sure it's the best plan for you. I actually have spouses who the wife has one plan and the husband has another. So when people come to me and say, my neighbor has such and such a plan and thinks it's the best thing in the world, I say, well, your health needs and your medications are different than your neighbor, so we really need to sit down and take a look and find out which program would be best for you.
Okay.
So we provide all of the information. We are an unbiased program, so it's up to the person to make the decision. A lot of people say, well, what would you do? And that's not something that I can say. I can just repeat, these are your options. Which one do you think would best fit your lifestyle?
Gotcha. So it sounds like it'd be best to, have that time with the counselor to ask the questions and maybe even find out the questions you don't know yet,
Right.
before you then make your decisions or decide to go with one a vendor or another, so that you then are prepared for the questions for them, okay,
Right.
to say.
And
okay.
it's not unusual to have a follow-up appointment with a counselor if someone comes in green, not knowing anything about Medicare and thinks they're going to sign up that day. Then they find out the whole scheme of Medicare and how they need to navigate the system.
Yes.
They say, oh, well, let me look over all this and set up a follow-up appointment, and then they'll be more knowledgeable and more able to make
And that's the
a
reason I
decision.
started studying a couple of years ahead of time.
Okay.
Because I knew it was going to be more than what I could, completely understand in a short period of time. The donut hole. Tell me about the donut hole. Does that
People,
still exist, or?
People like donuts, but nobody
uh-huh.
likes the donut hole.
Right.
The donut hole is with your prescription program. You go along paying a certain amount for your prescriptions until you reach $33,000 some $100, and then it goes up, where you pay it used to be 75%. Each year it's coming down, and they're closing the donut hole, where I think this year you pay 45%, where the typical amount is 25%.
Okay.
Then you ride along until you hit what's called catastrophic coverage, which is a little over $7,000. Then you go down and you pay even less than you were paying in the beginning. But while people are up here in what they call the donut hole, their prescription costs will be much more than they were in the beginning. And, people, we receive a lot of phone calls. People say, I've been paying $19 for this prescription, and all of a sudden it's $32. What happened? And I say, is there a chance that you could be in the donut hole? And they say, oh yeah, my pharmacist did mention something about that.
Okay.
And you have to explain that if they have enough prescriptions, they will come out of the donut hole, and if not, that's just how the program is at this point. By 2020, the donut hole is supposed to be closed, where it will not go up and then come down. It'll just be stable throughout the year.
I'm sure people won't mind that at all
No,
when
they
that
won't.
disappears. Over the last year or two, there have been a lot of reports in media where a drug is jacked up, 700%, 2,000%, et cetera. If I'm on one of those drugs, okay, and it's February, and the company, shoots up the price, does that throw my whole, what I thought was a really good analysis of what I was going to need? What happens at that point?
What happens at that point is, yes, that will throw a monkey wrench in your plan. And what I recommend is each manufacturer has what's called a patient assistance program, where they receive federal funding to provide prescriptions at low or no cost to people under a certain income level. And it's not a low income level, it's usually a much, much higher income level than any of the other income eligibility programs. So I recommend that people go directly to the manufacturer and apply for the patient assistance program.
Okay, yeah, I believe the latest one was what, the EpiPen?
Yes.
And it came out and there was such an uproar that within a week I was hearing all kinds of news reports. Well, you can get it for this now, or you can get, it's like the
Right.
company brought it down to, I guess, judge, you know, when the uproar was going to die down because of what they attempted to do with that.
Right.
Okay,
And we see it not so much with common medications like the EpiPen, but we see it more of it with the cancer medications or the renal medications, things that are
hepatitis, I
Yeah.
believe is another big one there.
things like this morning I was speaking to a man where his medication for his prostate cancer was going to be $9,000. And he said, how am I supposed to pay for this? And so he was going directly to the manufacturer. So and obviously I haven't heard back from him yet, but they usually do receive assistance. The manufacturers do not do this out of the goodness of their hearts. They are receiving federal funding for the patient assistance programs.
Okay. If that should happen to someone where one of their prescriptions just shoots up sky high, is that an indication that they should pick up the phone and talk to one of the Apprise counselors to say, I need help figuring out how to shift away from the plan I'm on?
Well, the first thing they should do is speak to their pharmacist and find out what happened. It could just be an error at the pharmacy level.
Okay.
And it could be that their card was not put through, that their insurance was not charged. So you need to find out where the problem lies. And then if you can't find that out, then I would call the Apprise program and see how we can help with that.
Okay, okay, gotcha. Here's a big question that I think a lot of people have on their minds because of their experiences over the years when they've had medical issues. And that is, can I be denied Medicare because of past medical conditions that I've had?
And unfortunately, the answer to that is yes to a Medigap. And the Medigap is the type of program that covers the extra 20%. The one that travels with you throughout the country, any place that takes Medicare. You have a free initial open enrollment period, which I said was the 3 months prior to your 65th
Right.
birthday, the month of, and the 3 months after. During that 7-month period, you cannot be underwritten or charged anymore due to a medical condition or your age. Outside of that initial enrollment period, for a Medigap plan, you are subject to underwriting. And a lot of people get that confused with the Affordable Care Act. They say, oh, well, I thought Obama did away with that. And pre-existing conditions are not allowed to be underwritten with the Affordable Care Act, but with Medicare, with the Medigap plans, they are.
But not initially, not when you initially
Not initially.
apply, okay.
And
But if
even
you
if
wanted
you
to
can-
change out,
If you wanted to change out, yes, they
That's-
could look
okay.
at that.
Mhm.
With the Medicare Advantage program, there is no underwriting. So they're the
Okay.
HMO type plans. There's a set price according to where you live, and they're either issue rated, community rated, or age rated. So, and other than that, they do not underwrite you for any physical conditions.
Okay, so if you're in the Advantage program from the first time you're eligible for Medicare all the way through, you're not going to see any changes except for, I guess there's always going to be some price adjustments for the
Right.
cost
And
of the
that's
program.
when you'd
but-
want to look at your annual notice of change to find out what your changes will be for the upcoming year, but they cannot underwrite you for any physical conditions.
Gotcha, okay, okay. I know I had a CPAP issue, and I tried to change insurance, and some companies wouldn't take me, okay? And other companies said, okay, we'll take it, this is what it's gonna cost you.
And this was with Medigap.
Yeah, no, well, this was before Medicare. That's
Oh,
why, like,
okay.
when I got into Medicare, I said, yes, You know, they can't, start kicking me around and mistreating me like that. I mean, I always figured like, okay, so I have a CPAP machine, and so what's the worst thing that's gonna happen? If I don't use it, I'm gonna die, right? I mean, so it's not,
I don't mean
why
to
are they
laugh,
concerned?
but-
Why are they concerned, like, if that's what's gonna happen? Nothing else seems to happen with people with that issue, but at any rate, that's beside the point. So another question I had was the switching back and forth, okay? Can you switch back and forth from one Advantage program to another Advantage program without jeopardizing, or is that just the Medigap?
This becomes confusing because most people cannot switch back and forth between a Medicare Advantage program to another one other than during the annual enrollment period, the
Okay.
October 15th through December 7th. Excuse me, and it takes effect January 1st. There are some people who are of low income. If they have Medicaid and Medicare, they can switch once a month. People who are in nursing homes can switch once a month. And there are some outstanding conditions like that. Some people on low-income programs can switch once a month or once a year, but outside of the annual enrollment period. But typically for most people, it is just during that annual enrollment period, October 15th through December 7th, when you are allowed to switch.
Gotcha, okay. Again, last thing I have here for you, although I'm sure like I could have come up with another 100 questions, but how much can we absorb in one small time period? I've heard a lot about Medicare fraud. Now, I know that's not something that the Apprise program has any control over, involvement with, but I understand it costs like billions and billions of dollars. I'm always reading articles. Do you have any advice for people on Medicare when they're confronted with what they think might not be
Right, it's not just
proper
billions.
billing and
It's
stuff?
not just billions and billions, it's in the 60 billion range.
60 billion,
60
okay.
billion range. And what we encourage people to do is, number one, like I said, never give out your Medicare number or your personal information to anyone. Nothing is free. If it sounds too good to be true, it is too good to be true. Go with your gut. Report it. I actually had a man who had received a flyer for a program called Extra Help to help with his prescriptions. And while it is a legitimate program, they were asking him for his Medicare number and his birth date. And it was not from a legitimate source. So he filled out the card and then he said, something just told me I should call before I send this in. And I'm glad he did. It was a place in Arkansas which is a Pennsylvania programs that they were trying to get people's Medicare numbers for.
Mhm.
And like I said, if you do not initiate the phone call or initiate the contact, do not give your information out to anyone. And if you do come across fraud, report it, because chances are if it's happening to you, it's happening to thousands of other people.
Are consumers ever responsible for any Medicare fraud that is thrust upon them?
Yes, they are.
Oh,
There's
okay.
actually a scheme called the grandchild scheme, where someone calls and says your grandchild will be put in jail or incarcerated if you do not pay this amount of money by a certain date, and they get people all riled up because it's a time frame, and people are responsible to pay that money. That's another thing. There's nothing with these insurance programs that are early bird discounts or time frame other than your open enrollment time frame, but there's nothing, if you sign up by October 30th, you'll get a discount.
Right, okay.
That's not
Mhm.
true. That's just salespeople trying to push their program on you.
Mhm. Okay, but would the consumer be responsible for any overcharge by a doctor or a hospital? I mean, where does all the fraud accumulate, the $60 billion worth of fraud accumulate? Is it the consumer involved in that, or is that
It's a
just
lot
mostly
of it
overbilling?
is, well, it used to be the scooters. Now there's a
Okay,
lot of
mhm.
the IRS. There are a lot of schemes out there for free diabetes supplies.
I've seen those on TV, yeah.
Right.
Yeah, okay.
So, like I said, they are responsible if they give their number out and Medicare's billed, they're responsible for their portion of that.
Okay, okay.
And like I said, if it doesn't feel right, don't do it. And if you are pretty sure that it is fraud, report it.
Okay, okay. Well, Janine, thank you very much. Very, very enlightening. This is part of my ongoing education as far as Medicare goes, because there's always something.
And it never ends. There's always something
It never
new.
ends. It's true. Well, if you've been watching this program, this broadcast, it's means you're watching it on Verizon Channel 31 or Comcast Channel 22. It's broadcast every day of the week, 10 a.m. and 10 p.m. Before we go, I'd like to alert you to one more future item coming up, and that is Representative Marguerite Quinn will be hosting her Senior Expo on October the 7th. That's Friday, the October 7th, here at the Senior Center at 700 Shady Retreat Road. So thanks for joining us, and we'll see you again next month.